Thank you. Dr. Lee, would you say that democracy is important in the United States?
Yes.
Would you say at times it's at threat?
Yes.
I would agree. What I would say is, let me ask you this. Would you think that an authoritarian state that does not represent the elected people is a threat to democracy?
I'm happy I don't live in an authoritarian state in a democracy that we have here in the United States, so I cannot tell you from personal experience.
Well, so I humbly disagree because unfortunately what we're seeing here, in my opinion, is an authoritarian move. This new executive order is not being conducted by the legislative body, people that were elected to represent the people of the United States. It's being written by people who have never run for office, to my knowledge, probably never run for office, don't have to answer to any voters whatsoever. So, is it Thier?
Thier, yes.
Okay. In an analysis of the executive order last year, you stated that the unilateral and heavy-handed administrative meddling in AI markets could undermine America's global competitiveness and even the nation's geopolitical security if taken too far. Has this executive order gone too far?
It very well could. You know, Congressman, just this week, Saudi Arabia announced historic investment in its AI capacity, something like $40 billion. Last September, the government of the UAE came out with an open source AI model that is 2.5 times larger than America's largest open source AI model. So it's not just China we face off against, it's all sorts of countries. Russia just developed one of its biggest supercomputers. If this executive order shoots ourselves in the foot as a nation and holds back our innovative capacity, that has massive ramifications for our competitiveness and our geopolitical security.
Yeah, my other question has to do with this, the fact that the executive order establishes an HHS AI task force, tasked with developing a strategic plan to regulate aspects of AI in the healthcare industry, including research and discovery, drug and device safety, healthcare delivery and financing, and public health. Could this lead to an onslaught of additional regulations?
Absolutely, and we're already seeing it. We should keep in mind our federal government is massive. 438 federal departments, 2.2 million civilian workers working at them. Every one of these agencies is interested in taking a look at AI. This executive order essentially gives them the green light to do so and says go for it without any express congressional intent.
You know, as someone who worked in the healthcare IT industry for 20 years, I can tell you that this place doesn't aid, was not helpful in improving the lives of the American people when it passed under the American Recovery and Reinvestment Act, the meaningful use criteria, that every software, electronic medical record system had to accommodate in order to continue to receive full reimbursement from Medicare. The outcome, I think, my statement, the outcome is basically proven that. And that is that all of what that regulation did was shut down many electronic medical record companies across the United States, which forced doctors to consolidate, change their records, migrate them to a new platform, or to stand up a platform altogether that they weren't, they were happy with the paper chart. Would you agree with me that that outcome, that creating what is basically a duopoly in the healthcare IT space, is not good for doctors, not good for patients, not good for consumers?
Yeah, well, of course not. And of course, this effort by the administration is just going to add more compliance costs and regulations on top of it. I know you mentioned this at the last hearing on this, Congressman, that these sorts of burdens can compile and build up on small innovators and force them to move or get out of the field.
Thank you. And at the end of the day, it was said that if we don't take action, the states will take action. Well, I seem to recall that the United States Constitution and this system of government didn't create the states. In fact, it's the other way around. The states created the federal government. And in the 10th Amendment, it specifically says the power is not delegated to the United States by the Constitution, nor prohibited to the states, are reserved to the states respectively or to the people. So my question to you is, isn't left to the states, wouldn't it be better to have a microcosm of experiments, especially in a field that we know so little about at this point in time?
Depends on the rules. There's a lot of proposals out there, a huge increase in the sort of compliance burden if we have too much of a patchwork. The leading law on AI hiring right now in the nation is from New York City, not New York State, New York City. You can imagine if every city has its own plan on AI, that could be a problem.
Thank you. My time has expired.